Hi, I'm Dan from Correct Osteo Clinic, and today I want to talk to you a little bit more about hip mobility. So I'm going to show you an exercise to try and improve your hip mobility. I get a lot of patients that have really tight hips, and this is one of the exercises that I think that always works well. You can even use it as a warm-up for things like compound movements such as like squatting and deadlifting, or even just to warm up your hips in general before you're doing a leg workout or any other sort of exercising really. Alright, so what you do is start on the floor, get a few mats, so you put them down, and what I want you to do is try and sit comfortably in this position, okay? So your sort of heel's going to be just on your other knee, alright? So you're going to sort of start off in that position, then you're going to let your legs go down to the side. You should be able to sit quite comfortably. If not, you might find it tight, you might have to feel like you're holding yourself up like this a little bit more. But hopefully, ultimately, we want to get you to a nice comfortable position like this. Alright, so this leg is into external rotation, this one is into internal rotation. So now the other way, this one is in internal rotation, that one is in external rotation. Okay, so you want to start off in this position. What you can do as like a warm up, you can go from side to side. Okay, so you're doing that and then that. You can, if you want to, keep your feet on the floor and do it like so. Okay, so you're getting a little bit more internal, external rotation and internal rotation as well. So this one, like I said before, internal rotation, external rotation, and this one now, external rotation and internal rotation. Okay, so that's one of the exercises. To then progress from that, what you can do is start off this position, and you're going to go into sort of like a lunge position. So now you're getting the flexion and extension through either hip. Alright, so you're going to stay from here, and then you're going to go up and into a lunge position. So now you can try and pull it forward and back, forward and back. Okay, so then start from the beginning. We're going to go from here, and then without any hands. If you need to use hands, it's not a problem. You can stabilise yourself, not a big deal. It's all about progression. Try and progress slowly into these exercises. And I don't mean in one session, you can do it in multiple sessions, not a problem at all. Just slow progression is great. So you're going to go from this position into that lunge position. Okay, now this one here, the one that's behind here, so this one here, my right hip, is now into extension. So I'm pushing it into extension. Try not to get the extension from your lower back, so you don't want to be bending your back too much. Okay, you want to try and get it from the hips. Alright, so you're going to do that. Then you can start focusing on the other side. So again, like I said, go to the other side. Alright, and then what you want to try and do is get up into that position, into that lunge. Alright, so now you're going into extension with this hip, and this one is in flexion. Alright, so this one's nice and flexed, so nice 90-degree angle. That one's pushing into extension. Okay, like that. So what you can do from there, if you want to progress it even further, is then push it into more of a squat position. Alright, so you're getting all different types of movement: adduction, abduction, flexion, and extension, all from the hip. Alright, so this is the whole thing all together. Alright, so from this, you're going to go from here into that lunge position and then into that squat position. Okay, so nice deep squat from there. Okay, so ultimately you should be in that position there. Alright, so you can go back to that lunge position and then you're going to go back into that internal external rotation position. So that should be nice and easy if you are quite mobile. And you can, as you can see, I'm quite mobile with my hips, so for me it's nice, it flows quite nicely, I can sit here quite comfortably and it's fine. However, you might not be able to start like this if you're watching the video because of you've got hip mobility problems. It might be quite difficult, so you might have to try and just support yourself a little bit more. It's not a problem at all, like I said. If you need to do that at the start, just start off with that gentle internal and external rotation. Okay, if you can get to there, it's not a problem. Try and hold it. If you need to push it back up against the wall, it's not a big deal to help support you, not a problem. if you can, just try and sort of push them down. Don't force them. If it's too painful at any time, just give us a call. We can go through it with you. We can talk through it with you. It's not a problem at all. All right. So try and push it sort of down into that internal rotation, this hip, external rotation, that hip. All right. And then you're going to flow. Once again, I'll show you into that lunge position, and then into that squat position. Okay. So that's the hip mobility exercise that I'll always suggest to my patients if they've got tight hips. I hope that helps you. Thank you.